Now at 6, stretched thin. Hospitals near capacity. New York stockpiles emptying. What's needed now when supplies could run out, putting lives at risk?
And the toll this virus is now taking on the economy as unemployment numbers hit a staggering new high. The places hit the hardest in our area.
We're all banding together and trying to do what's right.
From the sidelines to the front lines, the big boost coming from Patriots owner Robert Kraft, what he's telling Only News 4. Good evening. I'm Chuck Scarborough reporting from home.
And I'm Natalie Pascarella. A new recommendation just handed down from Mayor de Blasio tonight. All New Yorkers are now asked to wear a face covering while in public and near people to prevent the spread of the coronavirus. But avoid using masks, saving those for healthcare workers. Governor Cuomo says the state has enough ventilators in the stockpile to last until April 8th. That's just 2,200. Hospitals going through them at a rate of 350 per night. New Jersey has now seen its deadliest day so far since this pandemic began. The toll now jumping by 182 overnight. That's a 34% spike. Here's the snapshot of the tri-state for you now. New Jersey has 537 deaths with more than 25,000 cases. Connecticut has more than 3,800 cases with 112 deaths. And New York still leads the nation with more than 92,000 cases and 2,373 deaths. More than 7,400 have been discharged, though, so some good news there. News 4's John Chandler live in Whitestone, Queens, with new information handed down tonight. John.
And there is a lot of information tonight to process in residents and neighborhoods like this quiet place here in Queens. The city really wants the urgency of the moment to resonate. Why this playground behind me and city's playgrounds all over will sit closed going forward. And it's why I am covering my face at this moment, because within the last hour, a major shift in messaging. Mayor de Blasio asking New Yorkers, if you're outside, to cover your face, not necessarily with a surgical mask. You want to save those for the medical workers. But if you have a scarf or something similar, use it to cover your face.
It could be a scarf. It could be something you create yourself at home. It could be a bandana. It does not need to be a professional surgical mask.
Mayor de Blasio bluntly saying his city is facing a wartime dynamic. And Governor Cuomo says the state is running out of ventilators for New York's overrun hospitals.
If that rate continues, in our stockpile, we have about 6 days.
EMTs now must make life or death calls. New policy instructing not to deliver patients in cardiac arrest to emergency rooms.
This is what the military does. They come, they check your pulse, no pulse, next. You know, we're going to be leaving bodies behind, which is the exact opposite of what the oath we took.
Orrin Barzilay is a paramedic and union president. Next to him, union vice president Michael Greco worked a volunteer shift in Long Island in an ambulance Wednesday night.
Our members are going to have to look at somebody and stop resuscitative measures and go put your head on the pillow and know that we could have done more.
They worry 16-hour shifts will exhaust an EMT force already depleted by COVID-19. They also fear exposure. Their Queens office has received over 70,000 masks, but those PPE donations passed along to everyone but EMTs, who can't use them since the FDNY hasn't yet vetted them.
We were never trained for this. No EMT, no paramedic was told how to go into battlefield triage mode. How to do wartime conditions in New York City.
And certainly those EMTs and medical workers in hospitals all over the city and the state in dire need of PPE. So that is why the city is saying if you do go out and cover your face, to not use a surgical mask, an N95, to use a scarf or a similar type of thing to cover your face when outside. Do you want to get to one other bit of news that we have just learned about moments ago? Governor Cuomo announcing that the Javits Center will treat COVID-19 patients. They have 2,500 beds as they've turned the Javits Center into a medical facility. Now, originally, it was not expected that it would be treating COVID patients. Those would be non-COVID patients there. But within the last hour here, we have learned that they will accept COVID-19 patients at Javits Center. The governor thanking the president for granting that. There is a lot of information coming, but I think it underscores the urgency of the moment right now in New York City. We're live in Whitestone, Queens. I'm John Chandler, News 4 New York.
All right, John, thank you. In New Jersey, Governor Phil Murphy toured a new field hospital set to open at the Meadowlands Expo Center in Secaucus. It's one of 4 to open, expanding hospital bed capacity by 1,000. News 4's Brian Thompson is live in Secaucus right now with this sobering new milestone for the Garden State. Brian?
Yeah, Chuck, and while we're not in New York, obviously, the mayor's advice certainly sounds very good on this side of the Hudson, too, to wear a mask. But certainly, nursing homes taking the brunt of much of this pandemic at this point. The death toll keeps rising, up some 17 new cases overnight. At least almost a third of the state's nursing homes now having at least 1 positive case. And now, with what we're hearing from the mayor of Woodbridge, is that after 3 fatalities at the St. Joe's nursing home last week, when everybody was evacuated over to a nursing home in Whippany, well, the mayor says he's heard of 4 more deaths at the new location. Governor Murphy and New Jersey's 2 U.S. senators seeing firsthand what just a week ago was an empty exhibition space. This, a 250-bed field hospital from the National Stockpile Reserve, opening as early as Monday, a furious rush to complete in just days.
Depending on the day, it could be 12, 14, 16 hours, whatever it took to make sure that this place is open and ready to receive patients.
As hospitals like Holy Name in the middle of New Jersey's epicenter of Bergen County, overworked staff and overused patient rooms are presenting one of many hospital crises across the tri-state. With the latest death toll, 182 reported in the last 24 hours in New Jersey, twice the state's highest daily count. Somber news from Governor Murphy.
We're not at the beginning of the end, and I'm afraid to say we're not even at the end of the beginning.
This first of 4 field hospitals will take only non-COVID-19 patients, but relieve pressure on swamped hospitals across the state. While staying home is still urged, talk about everyone wearing a mask drew this response from Governor Murphy.
We're short ventilators, we're short PPE, we're short beds, we're short workers. If we flipped a switch and said, general public, you need to wear masks, we don't have the masks.
Not to mention all the masks and gloves already being thrown away in supermarket parking lots and elsewhere. So bad that public officials are taking to social media begging people to stop. They could potentially be spreading an infectious disease. Meanwhile, concern over illegal gatherings in Lakewood, even illegal in-person schooling, has police making spot checks of private school buses. But as this school board video shows, they're simply delivering lunches to shut-ins. Now, one other step the governor took today, he authorized the state police commander to commandeer any medical supplies he finds anywhere in the state if necessary. He's hoping that's not necessary. Live in Secaucus, Brian Thompson, News 4 New York.
Brian, thank you. Well, it is hard enough to lose a loved one during this crisis, but imagine having to wait more than a week to have a burial, all because of the surge of deaths every single day that we're seeing. News 4 Chief Investigative Reporter Jonathan Dienst is live in the newsroom to expand on this. John.
Yeah, we're told some families waiting days just to get a death certificate and then days more for a loved one's body to be released. Some funeral home directors say even with the right paperwork, their staff is being turned away at some hospital morgues, being told to come back another day to try to retrieve a body for burial. Several funeral directors tell us the problem is overwhelming. Some hospitals acknowledging their staff is so busy trying to help the living that, yes, there have been delays in releasing some of those who have died from the virus. And some cemetery workers telling us that funeral homes need to call back because they can't handle any more burials for at least a week to 10 days. One cemetery manager, who asked we not name her, said she normally gets just a few calls a day. Today, she had over 100 calls. Several funeral home directors say doctors are delayed, too busy to issue death certificates. And in one case, a funeral director told us it has taken more than a week to try to get a body released from Elmhurst Hospital due to a paperwork error with the medical examiner's office. The medical examiner's office declined to comment, and a health and hospital spokesman did not get back to us today. A hospital spokeswoman for Montefiore acknowledged the broader issue, saying bodies are being stored longer than normal at hospitals, and they're trying to work with the city and funeral homes to come up with a solution. The problem is not everywhere. The New York Archdiocese says, as of now, its cemeteries can handle the requests coming in for burial. although attendance at funerals being limited to just 10 people with social distancing. Overall, a growing need for resources in the city for those who are passing away and their families. Back to you.
During such a hard time, too, as well. All right, Jonathan, thank you. Well, Connecticut is reporting 27 new coronavirus deaths since yesterday and 267 new confirmed cases. The total number of confirmed coronavirus cases in the state has now surpassed 3,800. More than half of those are in Fairfield County. 65 of the 112 reported deaths in Connecticut are from that county as well. Governor Ned Lamont has announced a new executive order affecting hotels and short-term rentals. So starting tomorrow, those will be reserved exclusively for essential workers and not vacationers.
Well, Natalie, this doesn't come as a surprise, but it's still staggering. Unemployment numbers just smashed a record that was only 1 week old. Last week, unemployment claims hit an unprecedented 3 million. Now they have doubled. They've doubled. News 4 reporter Glenn Beccaro tells us where our biggest job losses are in our area.
Just walk along any downtown area and it hits you. All those closed restaurants, stores, and small businesses means hundreds of thousands of people out of work in our area. That includes Karen Matthews, who's now worried about keeping up with the mortgage payments on her home in Lindenhurst.
The bills are stacking up, and I keep getting emails from, my mortgage company's emailed me about 3 times.
So just how dramatic are the numbers here in the tri-state? Well, let's look at where we were 2 weeks ago, the week ending March 14th, before our world was turned upside down. 3,400 people filed new unemployment claims in Connecticut the week ending March 14th. Now it's 10 times that, just over 33,000. New Jersey saw 9,400 claims 2 weeks ago. Now 205,000. And in New York, 14,000 claims versus more than 369,000. The industries most impacted: accommodations like hotels, food services, arts and entertainment, healthcare, and social assistance. New York City and Long Island have the biggest jump in claims. And for those of you expecting that economic relief check from the feds, if you have direct deposit set up with the IRS, well, then you could get that check in as little as 2 weeks. But if not, paper checks could take months to arrive. The Treasury Department is now working on setting up a portal so that you can give them your banking information to try to get that check sooner. In Mount Kisco, Linda Beccaro, News 4 New York.